Our leaders in D.C. pause and reflect on a sober milestone. 800,000 Americans have now died from coronavirus.
We have 1,100 deaths every day still, and we can't be cavalier about the fact that we're losing so many lives from this right now.
At the same time, a new threat is headed our way.
For Omicron variant.
At this point in the pandemic, every time we turn a corner, there are more questions. Questions about how we're doing in the fight and how much longer this will drag on. I'm Ben Briscoe. From now until 6, we're going to tackle those questions one by one to help you make sense of where things stand right now. $800,000 deaths is such a big number, you don't really comprehend it until you look at just one person. Kermit Wilson Jr. was the pastor of New Life Ministries Church in Greensboro. He died in September after spending 41 days in the COVID-19 ICU. He was unvaccinated, and his wife helped turn his church into a vaccine clinic to prevent other families from losing their loved ones. Still, we have hit more than 800,000 American deaths like Pastor Wilson. Here's what that looks like from a triad perspective. That is the same number of people living right now in Greensboro, Winston-Salem, and High Point, plus all the people in Burlington, Kernersville, Asheboro, Clemens, Lexington, and even Graham. Anytime we talk about the number of people who've died from COVID, the same question pops up from viewers like Ken. Is there a way to verify that all COVID-related deaths are actually from COVID? WFMY News 2's Megan Malaris spoke with the experts to find a verified answer.
Our sources are the CDC, the North Carolina Department of Health and Human Services, and infectious disease physician Chris Uhl with Atrium Health Wake Forest Baptist. They all say yes, COVID-reported deaths are COVID deaths, but COVID-19 might not be the primary cause.
It has to be listed on the death certificate as either the primary cause or a contributing cause of death. Sometimes, particularly the contributing cause, can be a little bit in the gray zone. And then it's up to the doctor who is dictating the death certificate.
The North Carolina Department of Health and Human Services notes our state's COVID deaths include people who have a positive COVID test, who passed away without fully recovering from COVID and had no alternative cause of death identified. The CDC's reporting guidance here is broader. It explains in most COVID-reported deaths, COVID is likely the underlying cause, listed below the immediate cause. For example, COVID-19 could prompt acute respiratory acidosis or lung failure, which is what ultimately caused the person to pass away. And that's where the reporting can get tricky.
For instance, if a person was in the hospital for 45 days with the initial admission for COVID and the actual death is due to a stroke complicating a long ICU stay, how would you record that death? Usually that would be recorded as a stroke as the primary cause and COVID as a supporting or contributing factor. Those are then be counted.
Dr. Uhl said that's why sometimes there can be some over-reporting of deaths in all public health scenarios. Yet national infectious disease expert Dr. Anthony Fauci testified before a Senate committee last year that he thought COVID deaths were actually underreported. Either way, experts note these counts even out over time and do provide an accurate measure of the trends. In conclusion, we verified, yes, it's true. COVID-reported deaths are from COVID, but in many cases, COVID is the contributing and not the immediate factor of death. The physician must determine those factors and record them on the death certificate.
The next big question we keep seeing from viewers is about a mask. Guilford County dropped its mask mandate exactly 1 month ago today. The County Board of Commissioners said health experts told them, it's safe to drop the mandate because of this right here. The percent of COVID test positive was staying below 5%. But since then, things have changed. The numbers don't look as good. The latest positivity rate came back at 10.6%. The 2-week average is just over 8%. County Commissioner Skip Alston told us recently any changes to the mask guidance are going to be based on expert recommendations.
We're going to be guided by health professionals Cone Hospital, High Point Memorial Hospital, our health director, our health department. All of our experts are out there, and they're giving us our expert advice, and that's the advice that we're going to be following. And that's the advice that we followed when we dropped the mask mandate.
So we reached out to the health department today to get its thoughts. It confirmed what Commissioner Alston said. Health experts will provide the most recent data to inform the county's decision process. It is worth noting that Winston-Salem still has its mask mandate in place. Mayor Alan Joynes says the county needs a 2-week positivity rate of 5% or lower over a 5-day average of fewer than 10 cases per 100,000 people. So for everyone else, here is where things stand right now. Masks are not required by law. It's up to each business to decide if they want to require them. But health experts really do highly recommend that you wear a mask in public. Take a look at why. The CDC website says every county in the triad, still a high level of transmission. That is a whole lot of red right there. Questions have also kept popping up about the Omicron variant since doctors discovered it. It's relatively new, so researchers, they're still trying to figure everything out. Here is what they do know. Pfizer says its vaccine is much less effective against Omicron without a booster. Moderna and Johnson & Johnson are still collecting data. Right now, North Carolina is one of more than 30 states with confirmed cases. But the variant is expected to spread because the CDC says Omicron appears very contagious.
In looking at early data on transmissibility of Omicron from other countries, we expect to see the proportion of Omicron cases here in the United States continue to grow in the coming weeks. Early data suggests that Omicron is more transmissible than Delta.
Omicron also raised questions about booster shots. Some vaccine developers have said they might need to make a new one to protect against the variant. But Dr. Anthony Fauci says that's not the case.
At this point, there is no need for a variant-specific booster. And so the message remains clear. If you are unvaccinated, get vaccinated, and particularly in the arena of Omicron, if you are fully vaccinated, get your booster shot.
Experts have said for months the way out of this pandemic is getting more people vaccinated. They said not enough people have done that. Right now, 66% of eligible people in our state have had at least one dose. So now doctors say we are facing two options here.
We could prevent that by getting everyone immunized, and we've said that over and over. I think it's pretty clear that people who've declared themselves as never getting immunized, well, they'll just get COVID. Because before this is over, everyone's going to get it immune one way or another.
And that herd immunity he's talking about might mean different things in different places. So here are the 3 key metrics doctors say we need to watch for. We can officially say the pandemic is over when infection rates, hospitalizations, and deaths all drop to very low levels. Doctors say we're not there yet. The truth is, it could be a while.